Joining us now, Dr. Ashish Jha, director of the Harvard Global Health Institute. Dr. Jha, good to have you on again. Researchers found no reason to discount kids as COVID carriers, but this is a pretty small sample size. And they also say that children still do not seem to be a major driver of transmission. So how much stock do you put into this particular study?
Yeah, thanks, Jake, for having me on. Those are exactly right. It's a small study. The good news is kids generally don't get sick, and we don't have a ton of evidence about how much they spread. But I think this study is one more piece of evidence that kids do spread the virus, and it just makes it that much more compelling that we really think hard about how to open up schools safely this fall.
Well, what does it mean? I mean, obviously, if kids can spread it, and in some rare but still factual occurrences get sick from it, some have died from it, what should we be doing given the fact that the American Academy of Pediatrics and Dr. Fauci and others are saying we need to reopen schools in the fall? How do we do that?
Yeah, so the single biggest determinant of whether we're going to be able to open schools and keep schools open is how much virus there is in the community. So when I look at large parts of the country right now and think if that's the level of virus we have going into September, we're not going to be able to keep schools open. So we've got to get aggressive about bringing virus levels down and accept that kids will do a little bit of transmission, and hopefully very few of them will actually end up getting sick themselves. But the level of virus in this country is going to make it very difficult unless we get aggressive by bringing it down.
And what would some of the risks associated with reopening schools be beyond the spread of the virus? Children do appear to be less affected by the virus. So I guess in some ways it means just a bigger threat to the community as well as to teachers and parents and grandparents.
Yeah, exactly right. So imagine right now in Phoenix, schools were opening. What would happen is that kids would show up, they might be infected themselves with mild symptoms. They would spread it to others, maybe a little less efficiently than adults, but still spread it. They'd spread it to their teachers and staff, and they'd go home and they'd spread it to their parents and grandparents. So they would become another source. And given that all these kids are getting together indoors, I think we'd see large outbreaks in schools, and it would become very untenable to keep schools open. That's why you got to keep the virus in the community low, because if we can do that, then we can open schools. And of course, I, like everybody else, desperately want to open schools this fall. We just have to get aggressive about virus levels in the community.
But schools aren't open right now, and in most places, I don't think camps are either. So we don't have these, little super carriers running all over the country, running all over the community, and then bringing it back home. And yet we're seeing this huge spike in cases all over the country. Most states are having an increase. What do we need to do to get a handle on this other than just pausing the reopening plans? What should governors be doing right now?
Yeah, so I think this is about the time when governors have to look themselves in the mirror and look at their senior leadership and say, how much do we care about opening schools this fall? If the answer is they care a lot, then I think the prescription here is pretty straightforward. You can't have bars and gyms open. I'm not sure you can have restaurants open. You've got to have mandatory mask wearing, and you've got to push on surveillance, testing, tracing, all the stuff we've been talking about. If you do all of that throughout the summer, I think there's a pretty good chance most states can bring their outbreaks much, much lower levels and then open up schools safely. And then you got to still do stuff like social distancing and tracing and surveillance in schools, but those will be kind of the icing on the cake. The cake is just not having the size of outbreaks we have right now in these communities across America.
Is anyone doing it the way you think it should be done? I mean, I don't even know of any state or commonwealth that is able to do the contact tracing that you and I have been talking about for months.
Yeah, the contact tracing is still moving slowly, and I think there is more and more pressure, and I think states are starting to ramp up. But I've been talking to governors about pauses. I've been talking about whether they want to roll back. And when they understand the choices in stark terms, schools this fall or bars now, those are your choices. I think more and more governors, even in places that aren't having large outbreaks, are realizing that maybe we can avoid bars in the summer and fall if that gives us a better shot at getting schools open this fall.
Dr. Ashish Jha, thank you so much for your expertise. As always, we appreciate it.